Hello, my name is Dr. Bill Owens. I wanted to take a few minutes to give you a quick introduction to the MD referral program. That way, you may get a little bit more detail and can sort of determine whether or not this is something that would fit you and your practice, and particularly your short and long term goals. Just some background on me so you can have an idea of where I'm coming from and where my expertise lies. I hold three faculty positions, one at the State University of New York at Buffalo, the School of Medicine and Biomedical Sciences. That's in the family practice department. I also hold two additional faculty positions in Texas Chiropractic College and at the University of Bridgeport College of Chiropractic. Within the medical school, I have set up two chiropractic electives, one for the family practice residency program and one for the neurology residency program. And what we do is we actually have those residents coming from the medical school into my practice, and they're able to follow us while we treat during the day. And this is designed to give them exposure to how we handle patients, how we view the patient, how we work on the patient, our different techniques, and followed up. One of the things we do in particular is provide them with a lot of the evidence-based research on chiropractic care too. So when they leave, they're ready to go back to their respective areas once they graduate, and they have immediate exposure to chiropractic. I also practice full-time. I have two clinics that I manage in Buffalo and in Rochester, and I am also certified in MRI spine interpretation and spinal biomechanical engineering. Recently, I was one of the few chiropractors to have gone through the Royal College of Physicians. The Royal College of Physicians Certified Physician Education Program is designed to teach medical doctors how to be clinical instructors. So just like when you went through your internship and you had an attending chiropractor that oversaw your work, same thing happens in medicine. However, there's an international organization that helps to train those clinical instructors, because as you know, it's different than you just going to a treatment room by yourself. When you have the patient that you have to care for, plus you're instructing somebody, training is important. And this was a huge part of my education as far as how medicine works. And this is an international standard. So the great thing is all of the stuff that I learned as part of this program, the MD referral program, you'll get. And I can translate a lot of that stuff and help you for, in a lot of places. Now, if you want to know a little bit more about me, as opposed to just the general overview that I gave you, you can go to the U.S. Chiropractic Directory and you can look up my curriculum vitae. If you go to the home page, there'll be a section kind of right in the middle that says search by name. If you just put Owens in there, you'll be able to see the Buffalo office and click on my credentials, and it'll give you my curriculum vitae. And that'll show you a lot of the writings and a lot of the lectures. I do quite a bit of chiropractic and medical CE. So the continuing education on the medical side is something that I will bring to you as well, and we can do those in your area. So we really lead through academics, but I want you to look at my curriculum vitae so that you can see that this is something that I do on a regular basis, and this is not just something that I'm starting out with. So what are some of the trends in national healthcare, and why are these trends important to your practice growth? Number one, the healthcare system is moving away from the use of opioid medication, which is obviously a no-brainer now, but 5 years ago, the drumbeat of addiction and overuse was just getting started. So this is very well established now, and most of medicine is looking for an alternative to just prescribing medication and having the patient sit there. The healthcare system is moving towards interprofessional collaboration. That is actually written into the Affordable Care Act. And now more than ever, I'm getting calls all around the country. We are working together. I have clients in 46 different states right now. And every day I'm getting calls that they almost can't keep up, because once you understand how to present to the medical community, they will seek you out in force. Chiropractic research is getting better than ever, and this is something that I will bring to you so we can show them the evidence to the published information that is not necessarily accessible for a lot of practicing chiropractors. Medicine in particular is looking for a professional to manage spine cases. Medicine has become a procedurally driven profession. So they don't get paid to hang on to a patient for months and months and months. They get paid to actually apply services. They get paid to do injections. They get paid to do surgeries. And because of that, they need somebody that's going to have their hands on those patients on a regular basis to kind of keep them in the loop until those procedures are medically necessary. Chiropractic fits that very well. And that's not to say we're working for them, but they will absolutely refer patients to you for that reason. And this occurs most predominantly with the chiropractic offices that have the credentials and are properly trained to accept those patients. And that doesn't mean that every chiropractor in the country is able to handle that and work together with them, but that's what this program is about, is to get you there. Lastly, the trend in national healthcare is moving away from medical specialty like surgery and high-end procedures to primary care. We're doing a major reversal of the way we've been trending over the past 30 or 40 years. And this is important because chiropractic fits very well into a primary care-based spine paradigm where patient management trumps specific procedures. So let's just look at the problem. Now, this was the latest statistics from 2013 from the CDC. And what you see is out of the total amount of complaints, self-reported medical conditions in the United States, and this is from 2012, musculoskeletal conditions are more commonly reported than emotional disorders, circulatory problems, sleep issues, respiratory problems, migraine and headaches, diabetes, cancer, and cognitive issues. And if you think about diabetes as a national concern, and you think of circulatory and cardiovascular issues as a national concern, in this case, musculoskeletal is almost 3 times diabetes and almost double of what circulatory and cardiovascular issues are. So this is a problem whose time has come to fix and address. And my personal belief is the reason this is not under control is because there's not more chiropractors that are properly trained involved with the global management of these cases. And interestingly enough, in this slide, this is from the 2013 CDC report as well, 16.3 million visits were reviewed, and they found that 76% of the neck pain diagnoses were diagnosed in the physician's office, and that meant MD and mostly primary care. So to say that they're overwhelmed from a spine standpoint is an understatement. Primary care medicine in particular doesn't even have enough providers to handle diabetes and heart disease. And when you put 76% of 16.3 million visits for neck pain on top of that, they're going to implode. That's why the care path for these conditions is horrible, because nobody has the time in primary care medicine in particular to handle that. When we look at low back, we look at 52.2 million. And again, 78% of those visits were established in a physician's office. So again, there has to be an outlet. These patients have to be cared for and managed somewhere. And medicine does not have the resources to do that currently. I know, I teach there. I talk to MD primary care doctors every single day. I have close friends that are emergency room doctors. I have friends that work in urgent care. I have friends that are surgeons and pain management doctors. It's really out of control, and they're looking for somebody that understands the paradigm to help these patients. Now, when we look at the pain management trend, this trend involving opioid analgesics, and again, a lot of the national data is not current to the year. So this is from 1999 to 2011, and this was just before the national trend really became so apparent that the media couldn't ignore it anymore. And when you see the red line is opioid analgesics, the blue line is cocaine, and the red line is heroin. And you start to see this giant trend in poisoning deaths from this medication. And the vast majority of these poisoning deaths really come from prescription medication, not the street like you would think. So recently, in March of 2016, the Centers for Disease Control and Prevention came out with a opioid guideline for prescription for chronic pain. And this is a huge document. and it contains tons of information. If you're interested, you can certainly download it. It's free and you can look through it. But I'm just going to read this real quick so you have a perspective on, this is where medicine thought patients with spine and musculoskeletal conditions should sit. And this is why we have a problem here. Opioid pain medication uses present serious risks. Opioid pain medication use presents serious risks, including overdose and opioid use disorder. From 1999 to 2014, more than 165,000 persons died from overdose related to opioid pain medication in the United States. In the past decade, while the death rates for the top leading causes of death, such as heart disease and cancer, have decreased substantially, the death rate associated with opioid pain medication has increased markedly. So there's not a solution. The solution that's currently there is killing people. So let's look at the program outline and what this is. So you understand a little bit about how the national healthcare system is poised to accept us at an unprecedented level from a chiropractic perspective. The first thing we're looking at is your clinical documentation and your curriculum vitae. I want to work with you and make sure that you're compliant and your documentation is easy to complete. I don't want you going home with charts. I don't want you doing documentation over the weekend. There's no reason for that. Most of the clients of this program leave the office and have no catch-up work. That could be done in any EMR system, and I can certainly show you how to do that. Also, from the curriculum vitae standpoint, that's your professional introduction to the other professionals. And if you're going to spend, which you have to anyway, money on continuing education programming, I'll show you which continuing education programming is best to build your curriculum vitae and build your expertise so that you're automatically going to get referrals from the people that know you and the people that you're going to meet. Our second point is then focusing really on primary care physicians. And those are family practice doctors and internal medicine doctors. And that's really the groundwork. We work with every primary care physician in a given area. However, when it comes to number 3, the medical specialist, we want to work with one in each discipline. And I'll instruct you how and why that's important. But what we do is we really leverage the reputation of those providers in a community to build your reputation with primary care physicians. And it's really, really a nice and easy way when the medical specialist invites you to be introduced to their primary care physicians. That's important. Fourthly, we're looking at urgent care centers. Urgent care centers and number 5, emergency departments in particular, are poised really to have some outlet for all of these people that come in with spinal pain complaints. And interestingly, they don't get paid to manage cases. They get paid to diagnose and release. And a big part of the program is me teaching you how to leverage that and how to instantly gain credibility within those departments and urgent care centers. Number 6 is the hospitals. There's a lot of groups out there that charge for hospital credentialing and building hospital departments and all these different things. That's all included in this program. I don't do that. I will help you to reach out to the hospitals, whether you want to just accept referrals from the primary care groups within the hospital, whether you want to build relationships with the imaging group, or whether all of the primary care doctors in your area are bought up by the hospital. It doesn't matter. I've worked in all of those levels, and I've successfully put doctors, including myself, into all of those positions. And maybe you're in a university town. Maybe you're in an area where the medical school really has access and controls everything. That's easy too. I can show you how to give presentations to residents. I can show you how to have them rotate through. Whatever you feel comfortable with, I can design a customized plan. And that's what's interesting. 95% of this program is the same no matter where you are in the United States. The 5% is where we're going to work on and customize your entry into this medical system. Now, from a results perspective, to this point in time, we have a little over 88,000 direct MD referrals to chiropractors in the program. And there's actually a counter at mdreferralprogram.com in the top right corner. And that will keep up as people come into the program. And as we grow, you'll see that ticker increase in those stats. So keep an eye on that. We're growing every day. Program chiropractors are becoming the number 1 referral source for spine. This is over physical therapy. This is over physiatry. And in fact, a lot of primary care doctors are now choosing the chiropractor, particularly the ones in my program, over medical specialists. And Medical specialists actually like that, and I'll tell you why once we start working together. A lot of MD specialists, particularly surgeons, are using chiropractors, properly credentialed chiropractors, to manage their cases between procedures. This is important because, as I mentioned earlier, the MD specialties are procedurally driven professions. That's where they make their money. They can't afford to have people hanging out in their office to be managed when they really want to do what they do best. That's where we come in, and that's why it's important. And yes, we do save a lot of people from surgery. We save a lot of people from injections. But when those types of procedures are clinically indicated, we're the best place to house that patient until they're ready. And those specialists know that. I have been successful in changing hospital bylaws for chiropractors to have access. We've done that through Allied Health, and we've also done that through medical staff. Number 5, which is interesting, I was just recently hired by Johns Hopkins, their primary care physicians group, which has thousands of primary care physicians. They actually have a chiropractor that's building a department within that system, and I was hired to review his charts for compliance. And I bring that up mostly to give you a perspective on medicine at a very high level is courting chiropractors. And at some point, those groups, those universities, those hospitals will all have triaging chiropractors. They understand the financial and the clinical value of that. And I'm suggesting that to you now because if this is something you're interested in, I would prefer you get started now so that you're that doctor as opposed to waiting and having those doors get closed. And I'm seeing it every day. If you're interested, I can get you into, as I mentioned, presenting to residents, having residents rotate through your school, through your practice from their medical school. However, there might not be a medical school near you. That's fine. It doesn't really matter. But if that's something that's an opportunity, I would suggest taking advantage of that. And let's look at, lastly, what's not working in the current chiropractic and healthcare world. Politics, certainly. I was involved in politics at a very high level early on in my career. I've been practicing 20 years, and that was a dead end. That's not working. That's all about other people. It's not about patients. Health fairs, that doesn't work because of social media, of the internet. People can get health information without going anywhere anymore. Mall screenings, that's been dead for a really long time. And in some cases, it's useful, and there are doctors that are successful at that, but there's much better ways of getting new patients. Yellow page ads, Groupons, and reliance of patients on referring. Just being in your practice and hoping that your patients are going to bring in their entire family, while that's an important part of building a practice, and I'm not suggesting at any level to give that up, it's not the best way to bring in masses of referrals. So what does this mean for you? What's the big picture? In the end, when you work with me, you're going to get referrals. Just check out the ticker. You're going to have more respect. And for me, that was an important thing. I want to be a real doctor. I want to be perceived as a real doctor. When patients come in, I want them to be compliant. I want them to listen to me because they respect me. I want the primary care physicians and the surgeons to say, yeah, Bill's a good doctor. Go see him. That helps. And that's, going to translate into more income. And there's no reason why you can't have all of those things. In particular, you will have referral sources that will continue with or without you. Once the primary care, in particular, community knows what you do and how you do it, it will never stop. And you're going to be amazed at how much they will use you. That's what they're trained to do. They're trained to refer. So what does it cost? This program costs $199 per month, which is obviously less than your average office telephone bill. I don't have a contract. You can quit at any time for any reason. So for $199 a month, I will be able to give you all of those things that I just talked about, including hospital, emergency rooms, urgent cares, primary cares, and medical specialists. When we meet, we will take advantage of the kind of the low-hanging fruit first. And we will look at the things that are going to be able to drive patient referrals into your practice quickly. And what else? What do you get from me? You get unlimited phone support and consultations with me. I'm accessible. You get me. I'm going to do with you what I've done with my own practices and with chiropractors in 46 different states. You have access to me as much as you need. You have unlimited access to over 500 consultations, videos, and instructions on how to do this. So you go to the website, you log in, and if there's certain learning issues, if there's certain things that you need help with, I'll have you go there and read and listen and review, and then we'll get back on the phone together. I'm also going to give you detailed instructions in research, particularly evidence-based chiropractic research to build MD relationships in a format that they have time to review and they have time to absorb. I see a lot of chiropractic research out there that is cumbersome, and most of the primary care docs that I know, I've reviewed it with them, and they have no time to do that. So we put our research in a certain format and in certain places, particularly in our documentation, that helps with this, and I'll teach you that. I will also talk to medical doctors with you. If you have a medical specialist or a pain management doctor or a surgeon that you're looking to build a relationship with, you can get them on the phone with me. If you have an emergency room director that you need help with, I'll talk to him with you, not for you, but with you, because you'll learn by hearing our conversation. If you have primary care groups, I will talk to them with you on the phone. I also offer clinical consultation, particularly on difficult cases, and that could be issues on MRI, CT. If you need research to justify care, that may be laser treatment, that may be spinal decompression, that may be flexion distraction, whatever it may be, I do that on a daily basis. That's also what you get from me for $199. So how do you get started? If you go to mdreferralprogram.com, and up at the top, you'll see home, and then next to that, MD Enroll in the toolbar. If you click on MD Enroll, there'll be a subscriber page. You can either do that through PayPal, or the best way really to do it is to click on here in the red circle, and that will give you the one-page agreement. If you fill that out at the bottom with all of your information and you fax it to my secure fax, so this goes right to my computer, it's not laying out there, so you can be comfortable putting payment information in there. If you fax that to me, I'll have you started within 24 hours. That's the best way to do it. So lastly, here's my contact information, Dr. Bill Owens. That's my cell. You can call me at any time. If I am on another call or it's late, I have a service that will answer. Just leave a message for them and they email me. So I will make sure to obviously and absolutely call you back. If you prefer email, you can email me at that email address as well. Or if you prefer text, you can text me. So I take all sorts of communication, and I look forward to working with you. Thank you so much for your time. Have a great day.